It's been illuminating listening to all of you today and hearing about the wonderful work you're doing on this very important subject. As a neurologist, I am grateful for all the volunteer activity here and the excellence of the work that's been presented. It is essential for the health and welfare of our profession, but it's also essential for the health and welfare of the public. And I'm here today not as a clinician, but to represent the consumer view. And at Consumer Reports, we've done many surveys and focus groups with patients and consumers to look at what their feelings are about the delivery of healthcare today. And I have to tell you that there is not that much compassion for physician distress. And it may be difficult to understand why that's the case, and we do find that people are very invested in their own physician on a personal level, but in clinicians as a group, there has been an erosion of trust, as has been mentioned so much already this morning. And so for a moment, in order to understand that, I'd like you all to think about the last time you were a patient, or perhaps a family member was a patient. You had access to the best medical care, colleagues, nurses, hospitals, and perhaps even cell phone numbers of the team that you were working with. Now imagine for a moment that you don't have that. You're in an unfamiliar city, you're in an emergency room or a clinic or a doctor's office, and you really don't have that access anymore. Furthermore, you may or may not have health insurance, and even if you are employed, even if you do have health insurance, you may be underinsured. You're already worried about out-of-pocket costs that are being generated from that encounter on that date. If you may be worried about the cost of the prescriptions that are being given to you or your family member. You may even have to make the decision between putting food on the table, paying your rent, or buying your medications. And perhaps it's no surprise that by some studies, pharmacy prescription abandonment rates reach 35%. This is a really serious problem, and it may give you an inkling of why there's so little understanding or compassion for some of the distress that's being expressed today. I think that putting the patient at the center of this discussion is key to advocate for the resources that you need in order to successfully address this problem. And if you all consider for a moment the patient at the center of this problem, the effect it has on physician, provider, clinician communication, and patient safety, it will reframe this problem in a way that is easier for the public to understand. It is imperative that the patient is at the center of this discussion, and that the sequelae that we've heard about so much this morning already are made paramount. We don't want the public to have to suffer from adverse events. We don't want the public to suffer higher rates of infection, to feel the sequelae of burnout that result in poor empathy with patients and all the other things that we heard about today. So I'm very hopeful that you will consider a patient-centric focus for the framing and messaging of this problem. Thank you.
All right, so I think the patient centricity and the analogies to patient safety are coming out very strong. So I just want to give everyone a round of applause again for all the groups. It's a lot of work. It's just been 6 months, and so I think your critique and your comments for Dr. Kirsch's section will be very important to shape the next stage. The next up, though, I think one of the things I noticed in training is the misalignment between internal and external consistency, where a system would say something, but when you looked under the hood, it wasn't internally consistent. So it's my pleasure to introduce Dr. Jay Kaplan, a national leader in emergency medicine, who's going to lead us on an internally consistent mindfulness exercise. Thank you, Jay.